Hello, I'm Dr. Eric Mazer. Today's Ask the Doctor question is, what are some of the recent advances in the diagnosis and treatment of lung cancer? We have an expert on the set, Dr. Nicole Carreau. She is an oncologist at the Whittingham Cancer Center here at Norwalk Hospital. Nicole, I know you treat a lot of lung cancer and very successfully. What are some of the advances that we're seeing, both in diagnosis and treatment?
So for diagnosis, we now recommend screening for patients who are heavy smokers. You can talk to your doctor, your primary care doctor, if you're a smoker and see if you qualify. And also if you've quit within the last 15 years, you want to talk to your doctor and see if you qualify for screening so that we can diagnose.
So this is like a mammogram for a heavy smoker.
Exactly, yeah. So we can diagnose it at an early stage and potentially remove it and even cure it if it's at a low stage.
And this can save your life. So I don't think there's any excuse for people not to be getting this.
Exactly. And then if you're a non-smoker and you're diagnosed with lung cancer, we actually now have found that there are these driver mutations, so mutations that actually are creating those cancer cells and helping them to spread.
So these are changes in the nucleus of the cancer cells that are actually causing them to be cancerous.
Exactly. And we have targeted therapies. So these pills usually, sometimes they're IV treatments, these are actually going directly towards the tumor cells and killing them. So they tend to have less side effects and they tend to be more effective.
Which is really amazing because for 25 years we've been looking for silver bullets, and these literally are the silver bullets. They understand these driver mutations are not driving normal cellular processing.
No.
They're just driving the cancer. And so they target that and they turn it off.
Precisely.
And the cancer cell dies. Just amazing. And as you said, there's literally been a flood of these different drugs coming out over the past dozen years or so.
And then immunotherapy is another thing. So we have many more options nowadays for treating lung cancer than just the standard chemotherapy and radiation that people are used to hearing about.
And some people are surviving long periods despite metastatic disease.
Absolutely.
That's fantastic news. Thank you so much, Nicole. So glad to have that good news. Unfortunately, that's all we have time for today. Please email us your questions and comments to healthtalk@newvancehealth.org. Thank you so much for watching. Stay well.